Hello, everyone. I am Rochelle Etienne, your presenter on the epidemiology and control of HIV/AIDS in the Commonwealth of Dominica. This presentation serves to provide you the current epidemiology and control of HIV/AIDS in Dominica by including the background of the country and its population, the development of HIV and AIDS, and how it has impacted the territory. We will also dive into an analysis of prevention and control strategies currently being utilized and strategies that could potentially be used to achieve the goal of eradicating HIV/AIDS in the Commonwealth of Dominica. The Commonwealth of Dominica, also known as the Nature Island, is a relatively small island of approximately 750 square kilometers in the Lesser Antilles portion of the Eastern Caribbean Sea. It is the largest, northernmost mountainous region of the Windward Islands, situated between the French islands of Guadeloupe and Martinique. The territory is divided into 10 parishes with a population of approximately 66,510 people, with the majority of inhabitants residing in urban areas. In terms of demographics, 86.8% of the population is of African descent, 8.9% is mixed, 0.8% is white or European, 0.7% is considered other, and 2.9% of the population is made up of the largest Carib Indian or Kalinago people in the Caribbean. The official language is English, but the dialect Creole, which is a French patois, is commonly spoken from its history of French colonization in the 16th and 17th century. Dominica is considered a developing country due to its susceptibility to natural environmental disasters, economic challenges, and issues within the government infrastructure. HIV in the Caribbean. The Caribbean is made up of 29 nations and territories with approximately 39 million people of African, European, Asian, and indigenous descent. The prevalence of HIV/AIDS in the Caribbean hovers around 2%, with 250,000 people living with HIV. The HIV/AIDS epidemic is a devastating issue in the Caribbean, as it has the highest incidence of reported AIDS cases in the Americas, with 12,000 new cases annually, becoming the second highest HIV prevalence in the world. Current interventions have contributed to a 49% decline in incidence, with a focus on preventing mother-to-child transmission, condom education, and providing antiretroviral therapy. The emergence of HIV/AIDS in the Commonwealth of Dominica began in 1987 with the first reported case. During the period of 1987 to 2000, HIV/AIDS remained relatively silent due to stigma surrounding the new epidemic and the lack of diagnostic testing. In 2004, the National HIV/AIDS Response Program, or the NHARP, was created as an initiative by the Dominican government to address HIV/AIDS on the island through education, prevention, and support services to raise awareness, reduce stigma, and offer continuous health care to individuals living with HIV/AIDS. The NHARP provided antiretroviral therapy that transitioned HIV/AIDS from fatal epidemic status to stable chronic conditions. Although we see a slight rise in the number of people living with HIV in Dominica, there is a decline in the number of new cases and AIDS-related deaths. In response to the first case of HIV/AIDS, the government developed a division within the Ministry of Health called the AIDS Central Office that has used voluntary human immunodeficiency virus testing and counseling, or VHTC, in which data collection via a paper-based tool was developed for primary healthcare centers, non-governmental organizations, and community-based organizations as a major method of surveillance. VHTC can be provided using rapid testing services at 13 healthcare sites. In addition to the VHTC, the patient monitoring and tracking system created by the Health Information Unit allows for patients' clinical information to be tracked from the initial entry into the healthcare system and throughout their lifetime. Healthcare providers that conduct the testing are guided by a testing questionnaire created by the USAID Voluntary Counseling and Testing for HIV Protocols and the Johns Hopkins Caribbean HIV/AIDS Regional Training that is provided to each individual during every testing session. All testing questionnaires are collected and analyzed by the NHARP. We will now transition into discussing the epidemiology of HIV/AIDS in Dominica. Since the first reported case of HIV/AIDS emerged in Dominica, there have been a cumulative 410 reported cases of the disease. As of 2024, there are an estimated 210 people living with HIV on the island, with males representing 72% of all reported cases. Dominica has an overall prevalence rate of approximately 0.1%, with 0.3% prevalence rate for males and 0.1% prevalence rate for females. Mortality rate of HIV/AIDS has decreased by almost 50% in the country from a rate of 14.46 per 100,000 people to 7.64 per 100,000 people from 2000 to 2021. In 2024, there were roughly 7 new cases of HIV infections and 3 HIV/AIDS related deaths. The age group that is largely affected by HIV/AIDS is 25 to 49, and vulnerable populations that are at a high risk of contracting HIV are men who have sex with men, or MSM, female sex workers, prison inmates, young adults 15 to 24, Kalinago people, and people living in rural areas. The predominant mode of transmission in Dominica is not clear, but the research alludes to high-risk behaviors such as multiple sexual partners and substance abuse increase the risk of these vulnerable populations. Historically, prevention methods that were previously used included health education, distribution of condoms, and access to prophylaxis in the primary hospital, Princess Margaret Hospital in Roseau. Current prevention strategies that are being spearheaded by the NHARP target specific proactive services, which include access to testing and counseling, health education, pre-exposure prophylaxis, or PrEP, and post-exposure prophylaxis, or PEP. Testing and counseling services are offered in the 52 healthcare facilities throughout the territory. Continued local education initiatives that serve to increase awareness of HIV through education of transmission, prevention strategies, and emphasizing the importance of testing regularly are offered. Additionally, access to PrEP, which is a daily medication that inhibits HIV infection in high-risk individuals, such as MSM and sex workers, have been extended to being offered in Grand Bay, Marigot, and Portsmouth, which are part of the primary healthcare districts. PEP, medication that prevents HIV after an individual has been exposed, is more widely being offered in all 24/7 emergency departments in the country. There are several different barriers in the control of HIV/AIDS in Dominica, which include social stigma associated with HIV/AIDS and receiving access to care. Individuals may refrain from using testing services and receiving care for HIV for fear of being recognized and discriminated against for their diagnoses or personal life choices. Criminalization of men who have sex with men. Dominica criminalizes MSM with the Sexual Offenses Act of 1998, Section 16, called buggery, which could result in imprisonment for 10 years or admission into a psychiatric facility. Inadequate quality of VHTC locations. VHTC sites are not adequately staffed with trained healthcare professionals or appropriate equipment for testing. Insufficient testing. There are considerable amounts of people not being tested, which leads to underreporting. Inadequate monitoring and evaluation system. Paper-based data collection tools are being utilized at VHTC sites and then collected and transported to the NHARP office. Lack of consistent data. Current data is not kept in a technology database, but documentation that is stored again at the NHARP office. Limitations of funding. Funding for HIV/AIDS programs are subsidized and depended on by the government of Dominica through external sources and agencies. And the lack of continuity with counseling after testing, so individuals may not be consistent in returning for continuous care and monitoring. Analyzing the current data and trends of HIV/AIDS in Dominica, it seems that the efforts and the initiatives are effective in stabilizing and controlling the outbreak with the decline in the number of new cases and maintaining a prevalence rate of approximately 0.1%. However, the lack of available sufficient data as well as the lack of reliable surveillance of HIV/AIDS on the island proves to be a concern. The NHARP is using a multi-directional community approach to HIV/AIDS in Dominica by providing education, expanding testing and counseling services, and facilitating support groups and healthcare resources for individuals living with HIV/AIDS. Through the Prevention of Mother to Child program, preventing transmission from mother to child in Dominica has a 100% success rate, as there are no new cases of transmission from mother to infant since 2011. This is through prevention services that deter new HIV infections and unwanted pregnancies in HIV-positive women, as well as providing HIV testing and immediate interventions as part of antenatal care for pregnant mothers. For individuals living with HIV, there are an estimated 65% of people receiving antiretroviral therapy. There are still considerable amounts of people who are not being tested, especially in rural communities, as there have been approximately 3,500 to 4,000 people tested through VHTC rapid testing services yearly. Based on key findings from a self-assessment of the National Strategic Plan for HIV/AIDS, areas of improvement for the current program include emphasis on analyzing and targeting vulnerable communities, expansion of programs resources by increasing financial supplements to the program, increasing access to HIV/AIDS testing and counseling. In using the self-reported deficiencies in the current prevention and control programs, a prevention and control strategy that could be implemented in Dominica is to increase strength and access of VHTC and resources to vulnerable populations and communities that would also include developing technologically advanced methods of surveillance that can be used across VHTC facilities. This is a multi-step strategy and is a considerable undertaking, as there are various aspects that need to be addressed and executed. In terms of strengthening VHTCs, an evaluation of staffing, equipment, and resources at each VHTC facility would need to be conducted. Each site would need to have an adequate amount of trained staff and resources and equipment that is necessary to provide testing and services in that area. To obtain staffing, a partnership with St. George's University School of Medicine could help address the need for healthcare providers, and training on testing services could be provided to students as an incentive of credit or internship. In order to increase accessibility of VHTC sites, current locations, which reside in the urban regions, would need to be extended to reach rural areas of the country and even within the prison system, possibly creating a mobile unit. Currently, VHTC locations use a paper-based data collection system, so in order to automate this system, creating a reliable, easily accessible, and universal healthcare database that inputs questionnaire data and a patient tracking system would be beneficial. For your reference, this is a list of sources that were used to obtain the information provided in this presentation. We have come to the end of this presentation, and I want to thank you for your time and attention to the information provided in hopes of making a change to how we can address HIV and AIDS in Dominica.